For 50 years, two things have remained guiding lights at Parkside Psychiatric Hospital and Clinic.
Parkside is looking at what the community needs, and we're trying to be very responsive to that.
A commitment to providing care with excellence.
Yeah, on a scale of 1 to 10, I'd have to give them about a 12 in every category. I mean, oh God, yes.
And compassion.
And I feel like that we're here on earth to serve people. I mean, that's our purpose, is to serve people. And so I feel like that I'm serving and making a difference in somebody's life.
What we at Parkside, along with many patients and their families, now celebrate began in the glory days of Dwight D. Eisenhower, Citizen Kane, and Benny Goodman, the Roaring Forties. It took a man with courage and great vision, Tulsa oil man and philanthropist Herman P. Taubman. In the mid-1950s, he recognized the community's need for a larger psychiatric facility, and he vowed to meet that need.
If someone cannot do for themselves, it's up to us to help them, and that's the way I look at life.
Mr. Taubman felt the same way. Those who could afford some of their care paid on a sliding scale, while the new clinic's board of trustees, 35 prominent Tulsa citizens, picked up the rest of the tab, assuming full financial responsibility for the indigent.
Parkside helps out lots of people with different type of problems. And I think if it wasn't for Parkside, a lot of people wouldn't get help if there wasn't a Parkside.
That commitment now shows every day with Parkside's focus on the patient, treating everyone with respect and dignity.
When you're homeless like that and you're on the street, there's some hard things and there's some hard people, and you encounter them constantly, and just being if nothing else, when you walk into a place like Parkside or you become involved with them, you realize that life isn't all black. I mean, you know, it isn't all colored black. You realize there's good and decent people.
Indeed. The headlines today are exciting and full of promise. Excellence in outpatient care.
I'm proud of what Parkside stands for, because we're really trying to get there, and we're working inside out, not outside in, you know, the people. So, I mean, come and see. That's all I can say. Just come and see.
Combating substance abuse remains a Parkside priority.
In 1984, I saw alcohol, marijuana, cocaine. There were other drugs, but not as common, not as frequent as those three. Now I still see alcohol, marijuana, cocaine, methamphetamine, but a wider spectrum. A lot of opiate abuse, a lot of prescription drug abuse now.
Parkside's food pantry now serves nearly 200 patients a month.
I had one mother to tell me that she only had a limited amount of money to buy groceries, and what she would do is feed her children once a day and put them to bed early so she would not have to hear them saying that they were hungry.
The By Your Side program also assists patients with medicine and clothing.
You can truly see, I mean, that all of us care. We go above and beyond. You know, there's not a one of us that does not go above our jobs, you know, step out of it and do whatever it takes.
Whatever it takes, especially as Parkside sees more families with issues of child neglect and abuse, there's a deep commitment to children and adolescents.
Kids tend to take on, I think all of us in this society tend to take on a lot of cares and pressures, and kids are most vulnerable with that.
I've been really surprised at the amount of kids that are doing self-mutilation. That seems to be part of the in crowd now, not just, you know, there were times when it was just specific groups of people, but now it's just kind of spread over to all, just in all areas. You know, it doesn't make any difference, you know, whether you're affluent or whether you're not. It's just, that's something that the kids are doing nowadays.
It touches me deeply, and it's almost difficult to fathom what some of the kids have gone through.
Parkside proudly provides an expanded residential facility with 20 beds for adolescents as old as 17 and another 20 beds for children as young as 6.
I mean, we've got some really talented people here. We've got mental health techs that can get a laugh out of a kid whenever he's really angry and switch it around where he de-escalates him until he's laughing. We just have a lot of really talented people here.
There's nothing that is going to come out of it but positive when you really care for kids and try to show them the direction that's most healthy for them to go.
Among the latest efforts to show kids a healthy direction, a mentoring program involving Parkside volunteers and a chaplain program providing kids with spiritual support. And sometimes with prayers, come pets. With pet therapy, it's about whatever it takes to reach a patient. And not just cats and dogs.
So we had like about 12 to 14, including an American alligator, snakes. I've had kangaroos. I'm looking for some miniature horses. Everything, everything. It is amazing to see somebody so psychotic, hearing voices and seeing things, and see them turn around and go, oh, that's a turtle. That's a turtle. Yeah, this is a turtle. You want to hold it?
Parkside's story is full of promise for the people of Parkside and for countless patients who depend on them. For Edna Ingalls, Parkside is giving her a most precious gift, restoring her memory. She now remembers her children and something that fills a once deeply sad heart with joy.
Knowing that they love me and that I love them. I know that.
There was a time when I was too miserable to live. I didn't want to be here anymore. I really didn't, you know, and just things are so much different now.
You know, one of the things that we've been working on is telemedicine, because there are a lot of people in the rural areas that still don't have easy access or any access to psychiatric services, and so we're beginning that process and hope to have that finalized by the end of the year. We know, too, that there needs to be a lot more emphasis in all types of medical care, and including psychiatric care, on wellness and preventative services. And so one of the things that we'd like to look at that I think is really important to us in the future is a new wellness center hospital, and, you know, to really look at the importance of proper diet, which is part of why we began the food pantry, exercise, all those other kinds of things that people can do to live healthier lives, management of their physical illnesses, and so we really are looking at that over the next 5 years too.
We've changed over the last few years in serving a lot more people with substance abuse. We're treating more children here. Geriatrics and other ethnic groups that are coming on in our community are going to need more help in the future. So I see that as a role for Parkside in the future as well.
With, you know, education and training and community involvement, and as well as developing quality programs, I see us, you know, moving well ahead into the Tulsa community.
I'm real proud of the fact that Parkside's willing to embrace younger kids. And they've been very supportive of whatever the kids need.
I feel like the type of service that and how we provide that service will ensure our future. And I know one of the most touching things that I had read in regards to Mr. Taubman was that someone else had stated that he deserves a living memorial in light of everything that he had done to ensure these types of services. And so we try to be those living memorials. We think our patients are living memorials to him. And I do believe that any service, regardless of what it is, that you provide with excellence and a commitment to it, that you will continue to be successful.